Okay, so here we are again. I'm not smart enough to use an iPad, but I did invite Devin. So Devin, I can't text you right now because I had to switch to my phone, but I invited you. So where are you? I mean, where are you at? You have to accept the thing, I think. Yes, Devin Cook wants to join your video. Accept. And all right, girl. Where are you? She's just there. She is.
I'm like, can you see me?
So it looks like we're gonna have to freaking do this on our phones because Selena is not tablet and or laptop savvy. So teeny tiny phones it is. So teeny tiny phones it is. Okay, so well we got it. We got it figured out at least. Okay, so let's preface this by saying, yay, welcome to our Wags, Whiskers, and Beyond Sunday Fun Day with your two favorite RVTs. We'll preface also by saying, as registered veterinary technicians, we cannot treat, diagnose, nor prescribe for your pet, but we can give you advice. So that's what we're here to do. We're here to talk about things and give you advice. Comment below if you have questions. We'll do our best to answer those. So today I wanted to start out with letting you guys know, well, Devin and I spent Friday afternoon and Saturday at the Oklahoma Veterinary Conference, learning things so that we can bring all of our education to you guys. That being said, RVTs, CVTs, LVTs, as technicians, we do have to have continuing education to continue our licensing, to be able to keep our licensing every year, just like the veterinarians have to. We are under strict guidelines, just like the veterinarians are, because we are licensed, registered, or certified technicians through the AVMA, and of course right now as underneath the OVMA because we work in Oklahoma. So the Oklahoma Veterinary Medical Association is the one who approves and or denies our licensing. We do have to keep those licenses up to date with our continuing education. And that's that. So we attended that this weekend. That was super fun. Did you enjoy it, Devin?
I loved it.
It's the cutest thing. I love her so much. Just the sweetest, cutest thing ever. This was her very first veterinary conference, and she was so excited. The cool thing about it is the exhibit hall. You get to meet people, connections, reps from all veterinary aspects, and thereafter banks and investments and all these other things. So as you're walking around the exhibit hall, you get these awesome free samples or swag bags, as we would call them. So Devin made a killing with her swag bags this time. She got all sorts of cool stuff. She is my good luck charm. I'm telling you, I won an actual raffle with her there, which I have never won a raffle before. So that is super cool. Devin is my good luck charm. Y'all, she's my good luck. So that being said, that was our continuing education for the year for us to be able to keep our licensing in the state of Oklahoma. Today we are going to talk about heartworm disease, something that a lot of people don't understand. You go into your vet clinic, you get your physical exam done, they draw some blood, and they say, hey, your pet was heartworm negative, let's get him started on heartworm prevention. Most clients just follow suit with what we say because we are educated, we know what we're talking about, just like if your doctor tells you to go fill a prescription, you're going to do that. So we are here to shed some light around heartworm disease so that everybody understands what heartworm disease is, how it's transmitted, how it's treated, how it can be prevented, the animals it does affect. So we're here to talk about that today. So Devin and I will be chatting with you about that. And again, if you have comments or questions, please let us know, or just say hi. Let us know you're here. Say hello. Hello. Nice to see you guys. Okay, let us know you're here. Let's see. So the info that I put up right before our Facebook Live that should be attached to it as photos, I did get from the American Heartworm Society. One of them did. It is the life cycle of the heartworm. So if anybody needs any more information, or if you want to follow up and look up heartworm disease in your dog or in your cat, the American Heartworm Society has a fantastic website for everybody to go on and read up and, you know, learn about heartworm disease. We'll touch on a bunch of things today, but it is a great website for you to go to. It talks about heartworm disease, life cycle, transmission, you know, preventions. They're a fantastic website. So definitely recommend going and looking at your American Heartworm Society website. We use that a lot too, just as veterinary professionals and educating clients in the clinic. So we use, you know, they have guidelines that we follow as well for heartworm testing and heartworm preventions. Devin, you're going to have to remind me, since I texted it to you. I don't remember what parts. I should have put it in my notes. Okay, guys, I'm still not prepared, and this is going to be a thing forever. But what parts
let me see if I can click away to it for a
see
second.
it. I should have, because I think it was treatment. That's what it was. I had put on for you to talk about treatments and symptoms, didn't I?
So you were going to talk about transmission, and
that's
then,
right. And then
and then I was going to talk about the symptoms and.
Awesome. And then treatments too. Okay. So transmission of heartworms. A lot of people don't know this, but heartworms are transmitted by mosquitoes. Another reason why you should loathe mosquitoes. Not only do they transmit all sorts of other bloodborne diseases, but they do transmit heartworm disease. How this happens is, so a mosquito will bite an infected pet or an infected animal. I guess it's not necessarily a pet, but an infected animal. And what that mosquito does is when it takes its blood meal, it actually sucks up, this is really gross, it sucks up those microfilaria, or the baby heartworms, into its mouth parts, where it holds on to them. Well, it's proboscis, I guess is what it is. And then, you know, he goes and he floats down the way, and he decides, hey, I want to take another blood meal, and I'm going to bite this cute little dog in the backyard that's just out here for a potty break on a beautiful spring day. So he goes down, and they can get through the hair, just so you know. People think because they have hairy dogs they can't be bit by heartworms. You got to think they don't have a whole bunch of hair on the inside of their ears. They don't have a whole bunch of hair on their bellies. They can get bit anywhere. Yes, it is harder if you have a super fuzzy dog on the back or something like that, but in the ears, on the belly, it all happens, okay? So the mosquito will then go bite your best friend that's out playing on your beautiful spring day going potty in the backyard, and he will transmit those microfilaria into your dog, and while he's taking his blood milk. And what those microfilaria do is eventually, over time, they actually migrate through the tissues into the muscle layer and then into the bloodstream. So as they get into the bloodstream, they circulate. And this is, again, where they mature, where they continue their life cycle. So they have to go through this phase, this way, to continue their life cycle. And not all animals are good hosts for heartworm. We'll talk about that later. Anyway, they continue their life cycle inside your dog or inside your cat. As they grow and as they mature, they do eventually migrate to the arteries, and they can migrate, or they do migrate to the heart, where they mature into adults. Okay, so as they reach sexual maturity, if the mosquito has transmitted more than one, you got a male, you got a female heartworm, they are going to produce more baby heartworms. They're going to produce more microfilaria. And what do those microfilaria do? Well, here we go again. They start the life cycle again. So they circulate in the bloodstream. The mosquito comes by, picks them up in his mouth parts as he's taking a blood meal, takes it to the dog or the cat down the street, and transmits heartworm disease to that dog or cat down the street. So when we tell you that it's really important for your pet to be on heartworm prevention because they are if they're heartworm positive, they can be transmitting heartworm disease to other dogs in the area. It's not because by touch or sneeze or licking each other or dog bites or anything like that. It's from that mosquito. So if your dog is heartworm positive, your dog can be transmitting heartworm disease to your neighbor's dog through that mosquito. So that's why it's so important to keep them on heartworm prevention, because if your dog's positive, he can make all the other dogs in the neighborhood around him or wherever that mosquito decides to fly to, he can make those dogs heartworm positive as well. Let's see. Did I talk to you? Was it symptoms or just treatment that I was going to have you do? I already forgot.
I think you're having me do both, I thought.
Okay. Well, I'm going to let Devin take it away as I look through disease transmission. If you have any questions, again, comment down below. Let us know if you have any questions, and we'll definitely try to touch on those things. I don't see any comments down there unless, my phone is just really ridiculous and I don't see anything, which it could be this. So Devin is going to take it away. She's going to talk to you guys about heartworm disease symptoms, what you can look for in your pet. And she's also going to talk to you about the treatments that we do to treat your pet for heartworm disease when they come up positive on our blood tests.
So as far as symptoms for heartworm disease, generally we will see like a mild persistent cough. Oh wait, we had a question.
I see that. What is the worst case of heartworms you have ever seen? Devin wasn't here for this one, but when I first started working at the current clinic that I'm at, we had a Siberian Husky come in that, of course, was there for annuals. He did have symptoms of heartworm disease. We did heartworm test him. He came up positive. And unfortunately, a lot of the times, heartworm treatment can be expensive. So owners do not have that luxury of being able to treat their pets. And the humane thing to do, because heartworm disease is fatal, let's preface by saying that if your pet does have heartworm disease, it is fatal. It is fatal to them if they're not treated and you don't have it's fatal, okay? So they couldn't afford to treat this pet, which happens a lot. And we had to end up euthanizing this pet. This sounds really gross, but for purposes, I kind of wanted to see what the heartworms look like, and this dog's heart was full of them. And when I say full of them, I don't just mean one or two in this dog's heart. I mean, 20, 30, 40, maybe even more heartworms that filled this dog's heart. Now you got to think, if your heart is full of heartworms, how is your heart going to efficiently pump blood to all of your organs? Because your heart is responsible for keeping all your organs healthy, by pushing that blood flow to all your organs so that they can get the oxygen they need, they can get the nutrients they need. So if your heart's having a really hard time doing that because it's full of heartworms, your body is just not going to be able to do what it's supposed to do. So it was really sad that poor dog's heart was full of heartworms, but this is something that we come in contact with every day because clients just don't know, so that's why we're here to educate you. What do they look like? Devin, what they look like? They're gross.
Like little spaghetti, like, I don't know, little strings of spaghetti.
Yeah, little strings of thin spaghetti, and they're white, almost opaque.
Yeah. They're
really gross. And when you think of a worm in your ground when it rains, the little worm comes crawling up through the dirt and it's all, they really do that. They squiggle around, they wiggle around. It's really freaking gross. Okay, it's really gross. Heartworms are really gross.
Yeah. Touching back on those symptoms, so mild persistent cough, we'll see exercise intolerance, decreased appetite, weight loss. If the heartworm disease is prevalent enough, it can cause heart failure and buildup of fluid in the belly. He said, do they ever come out of the pet?
Oh,
they do not.
My phone is lagging, so yeah, if you can see it.
I guess, have you seen the ones that migrate from the nose? Is that, or Dr. Phillips had mentioned that wasn't.
Yes, that can be a thing. So in severe cases, think about it as the heart's pumping, some of those worms might get dislodged from the heart. So as it gets dislodged from the heart, they can migrate through the bloodstream to other organs. So they can cause embolisms. They can cause issues with your liver, like Devin was talking about. So they can cause, and you can find them in other places. There have been people that have been able to pull heartworms out of the nose. I mean, it is,
migrate. Yeah.
they can migrate. They, do keep that in mind. It's just not like they're just secluded in the heart. If you have a heavy burden and your heart's trying to pump, some of those can get dislodged and go all over the body, But
Yeah.
no, they don't just come out of the pet like you would think with intestinal parasites. You can't just, pull them out of their bottom. Some people, though, some veterinarians in the past have been known to sedate a pet and actually pull them out. And I'm trying to remember, this was so many millions of years ago that not millions, but before I was an RVT and in vet med, they could do that kind of stuff where they could actually pull the heartworms out of the vessels. I'm assuming with some sort of scope. Super freaking gross, but luckily we don't have to do that now, because that's going to cause damage too. Keep that in mind. There's not supposed to be things being put in your body like that. Okay, so
definitely
super gross.
Yeah, so it's definitely life-threatening. It can, a buildup of those worms can cause heart failure. Can cause pale gums and other issues as well. Those are kind of the main things, especially if we have a coughing dog come in. One of the first things that we do is heartworm test them, just to make sure that that's, rule that out as a diagnosis. My cat's biting me, sorry. Say hi, Kyla. He's like nibbling me right now. I'm like, okay, you're gonna get down. You're gonna keep nibbling me.
Such is our life. I had the doors closed, so none of mine could get in here, but if they could, I'm sure we'd have visitors too.
I was like, I'm going to be nice and allow him, because he wanted to be near me, but he's being a little turd right now. So I think he wants to take a nap. He's over on the couch now.
It's a good day for that. It is so cold. It's a good day for that, man.
It is. Yeah. So I think I touched on the symptoms mainly, and then we were talking about treatment. There's, I think, two main options as far as like treatment. I guess we could say three. So, but it wouldn't really be much of a treatment. Would be euthanasia, like you talked about, if owners can't afford treatment, and that is the best option for the dog. But the two main options for treating and hopefully clearing the case of heartworms is a injection of a imidacide, which is an arsenic containing compound into the dogs, or a slow kill option, which is slowly killing off those heartworms with just heartworm prevention. When we do a heartworm test and it comes back positive for us, we take a drop of blood and look at it under the microscope to check for those baby heartworms that Selena was talking about.
Malaria.
And you can see them in between all those blood cells just kind of swimming around, if they do have them. So if they do
keep that in mind. They're teeny tiny, so this isn't something that you guys are going to see. This is what Devin and I look at on a microscope slide to see them. You will not see them just squiggling around, as they're babies. When they're big, yes, but not as babies.
Yeah. And so that helps us determine how severe the case is. If there are microfilaria in the bloodstream, then obviously the dog has had the case of heartworms for a while, long enough for the adult heartworms to cycle through and create those little babies. So with that in mind, as far as the injection treatment, we hospitalize the dogs with us. We start them on a course of doxycycline, which is an antibiotic, because at the time when we kill off those heartworms, they can release a bacteria into the bloodstream that can cause a lot of issues for the patients, including, like sepsis, things like that. It can also cause the other adult heartworms that are there to die off suddenly, and that can put the patient into shock. So we definitely don't want that bacteria getting spread through the bloodstream. So we'll make sure that we start them on a course of antibiotics beforehand. They'll stay with us, and we give them that injection into their back. We try to keep them as comfortable as we can when they're with us, giving them pain meds. When we religiously give them pain meds, but especially if we see them uncomfortable, we'll kind of say, hey, doc, I think we need to increase our medication there.
Yeah. Your RTs are your pet's advocate. Woo-hoo!
Yes. We give them lots of blankets, and
that's what nurses do. They comfort. Okay, that's what we do. We're the comfort.
Yeah. We snuggle them. If they're there with us and they're a sweet, they have that kind of want to be snuggled. We're like, okay, I'll come lay next to you and cuddle you and help you through this.
We have the known to crawl in cages, so y'all are. We have the known to crawl in cages with your pet and snuggle your dog. Like, I'm not kidding. It's for real.
And then they have to be kept super low key. So we have to leash walk them. They do have to be crated while those heartworms are dying off. So they will get typically 2 injections with us. I think they're 24 hours apart, right? So we'll get the first one and then the next. They're usually hospitalized for 3 days with us. And then when we send them home, we make sure that we instruct owners on how serious it is to keep them low key. Since those worms are dying off, they will, as they die, travel through the vessels to the lungs, and they'll be kind of absorbed back into the body once they're dead. And so if your dog is running around and very active and they have these dying worms in their lungs, it can cause major issues, pulmonary embolism, all kinds of things like that. So that's why it's super important to keep them low key. And then that was the injection treatment. So that's the injection option, which is the more expensive option, but it is the more, what would we call that?
I guess it takes, it's faster. I guess it's gold standard because still, while you're doing slow kill, your dog is still a vector. Your dog is still able to transmit those baby microfilaria. If your dog has a heavy worm burden, is still able to transmit those microfilaria to the other dogs in the neighborhood. If we do what Devin's getting ready to talk about, which is the slow kill method. I do want to say one thing real quick about the doxy, which I think this is just the craziest thing ever. So doxycycline is also used because inside the parasite, which is the heartworm, inside the heartworm parasite, it carries a parasite called the Wolbachia. That sounds so disgusting. But the Wolbachia makes the heartworm more voracious, I guess, for lack of a better term. So when you give them doxycycline, it weakens the Wolbachia. So it kills off and weakens the Wolbachia, which makes the heartworm more susceptible to our heartworm treatment. And I know that sounds so weird, but a parasite inside a parasite makes that parasite healthier, and it's harder to kill off, which is so weird and so bizarre. But it's actually a thing. So the doxycycline does help with the Wolbachia as well, which is why we do also give it 30 days prior to treatment, which is so weird. It just blows my mind.
Crazy. What else was I going to touch on?
I'm sorry, you're talking about slow kill. I interrupted you. I talk a lot.
No, you're fine. I was going to bring up x-rays. We also will take x-rays to check the heart itself and the aorta. We look at all that, make sure, because those heartworms like to live in the aorta of the heart. And so sometimes if the burden is so big, you can see an enlarged aorta on x-ray, which I think I saw that once. Yes,
in severe cases, absolutely. And of course, red blood work too, make sure all of our liver enzymes, our kidney enzymes look good. Our platelet levels are fine. red blood cell levels are fine, white cells are fine, and we do run blood work too. So it's a lot of diagnostics too that go into heartworm treatment when they're in clinic, because it is a big deal. Like, it is a real big deal. Heartworm treatment is not only extremely painful for your pet, and we do try to limit the pain as much as we can, but they're still going to be sore. It is a deep muscle injection in the muscles that run right next to their spine. So it hurts, but heartworms can cause extensive damage to all the other organs in the body. It's not just the heart that's affected. So there are, you have to run some blood work, make sure this pet is going to even be able to get the heartworm treatment that we're going to give, make sure the heart's not too enlarged, make sure there's not significant damage in the lungs. There is so much that goes into this, which is why prevention is key. But okay.
One more key thing to touch on. I know there's just so much to talk about it.
We can do a follow-up if we need to too.
Yeah, definitely. It is very, very prevalent in the eastern United States, eastern southern, where mosquitoes generally are. I know a lot of my Tucson, Arizona friends that might hop on. Like, growing up, I never had my dogs on heartworm prevention. I never knew it was the thing, it wasn't as common, but it definitely is starting to spread throughout the United States. They're seeing a lot more cases in the Western United States as well. So it's definitely something that's very important for us to talk about and learn about and prevent in our pets as well. As far as slow kill goes, slow kill is not considered the gold standard. It is an option for people who maybe don't have the funds to cover, the hospitalization and the injections. It is an option. With slow kill, you will use doxycycline and heartworm prevention to just slowly kill off those heartworms. We do doxycycline, right?
Yes, you still do doxy.
Still do a course of that.
Because the heartworms are still going to be dying off, so you still have to take those precautions. It's just they die off more slowly. And of course, I'm sure Devin was going to preface this too. She's probably getting ready to say it, and I just cut her off because I talk too much.
Yeah, okay.
Do make sure that you're not doing this on your own. Obviously, you're doing it under your licensed veterinarian's advice. Okay. But there are certain heartworm preventions that you not have to use, but that you cannot use as a slow kill prevention. Mm-hmm. So your vet will put you on a specific heartworm prevention for slow kill, if that's what the route is that you choose to do with your pet, with, the advice of your licensed veterinarian.
Yeah. Generally, we'll send HeartGuard as our heartworm prevention for slow kill. Sometimes with slow kill, it can even take up to a year, if not more, to fully kill off all of those heartworms. Mm-hmm. They still have to have that exercise restriction. Ideally, you want to keep them low key while those worms are dying off. We also heartworm test annually on our pets because if we start a pet on heartworm prevention that is positive and does have microfilaria, that heartworm prevention can cause the microfilaria to suddenly die off and then cause that pet to go into septic shock. Yes. That's why we definitely always recommend annual heartworm testing to be able to get that prescription for heartworms, or heartworm prevention, not heartworms. You know what? We're not giving you those.
We're going to give you the heartworms.
We're handing them out.
So we're telling our clients that we recommend that they get put on heartworm prevention. It's really not because we're trying to get your money. I promise. We're more than happy to get you a prescription so you can get it from a reputable pharmacy if you can get it less expensive. If you can get generic, that's fine too. We don't care. As long as your pet's on a prevention, that's all we push for. Heartworm prevention is so, so, so important. So important. Yeah. We can't preface that enough.
With both of these methods, we do have the patients come back within 6 months to a year to re-heartworm test. I think you may be able to touch on this a bit better than me. I can't remember. Is it the antigen that the heartworms put off?
Antigen. So it kind of depends on the test that you use. So there's antigen and antibody. Antibody meaning just like, when people go get vaccinated, you develop antibodies for that specific virus. So your body will develop antibodies when it sees anything as foreign. So there is antibody and antigen testing. There's both. So it kind of depends on the lab you use, on the test that you use, whatever your veterinarian happens to be carrying at their practice. So nothing, not right nor wrong. It doesn't, antigen or antibody, just something. They will test your pet some way or another for heartworm. It doesn't matter what kind, just as long as we're getting heartworm tests done.
And it does take time, right, for the body to kind of clear out those, if I'm thinking right. That's why we do it 6 months to a year.
The antibody?
Yeah.
Just like when you're exposed to virus, you're exposed to the flu virus, or you're exposed to some sort of upper respiratory infection, your antibodies are a way for your body to fight off all those viruses, those bacterial infections, what have you. So it does take time for your body to kind of clear those. They kind of dissipate, I guess, for lack of a better term. Not all of them, not everything, you do hold on to some antibodies, but yes, it does take time.
I feel like I touched on, I don't know, if you think of anything, you tell me, but I think
you did. With the slow kill, with the in-house heartworm treatment, when we keep your pet in clinic with us, like Devin was saying, it is to monitor them. So when those worms do start to die off, they can cause embolisms, they can cause problems. We do want to make sure that we're keeping them in hospital so that we're watching them and we can treat them for what they need to be treated for if they have any adverse reactions, because they can have adverse reactions to the medications as well. So when we say we're hospitalizing your pet, that's why we're hospitalizing your pet. So your pet is there for us to be able to do what we got to do to make sure that your pet is safe and can go home with you. They also need, which she said they need to stay low key. The whole point of that is when they're dying off slowly, and I know she said this too, reiterated again, when they're dying off slowly, they still continue to circulate. So like before, when I said they'll dislodge from the heart, they can dislodge from the arteries and they'll continue to circulate. Eventually the body will break them down. Bodies are so cool. Eventually the dog's body will break them down and get rid of them as smaller molecules, I guess, smaller proteins, whatever you would say. So if you're going home on day 4 after we've hospitalized your pet, and your pet is running in the backyard and playing and acting crazy because he feels good, you take a chance of causing an embolism in your pet because they're allowing them to run and play. Now, that doesn't mean that they can't get up and walk to the food bowl or walk to the kitchen or walk around the house with you. That's okay. You don't want to increase that blood pressure and you don't want to increase that heart rate. That's what you don't want to do for the first 30 days. Someone has a cat question. We were going to talk about that too. I was going to talk about cat stuff. Hello, Ernest. That is my cousin. I'm so glad he got to join us. He is a kitty cat lover, Devin, as well. He and you could be cat buddies. You can go ahead and ask your cat question, and while you're typing, I'm going to touch on that. And Devin, if you see it before me, feel free to answer questions. My phone's slow. With cats are aliens, okay? They are so bizarre. So yes, heartworm disease can affect cats. It absolutely can affect cats. Cats, it affects them the exact same way, transmission is the same way it is in dogs. So they get bit by an infected mosquito, migrates through the tissues, into the muscle, into the bloodstream, and circulates. Cats have a different kind of immune system. So most cats have a, well-developed immune system that their bodies are able to rid themselves of heartworms on their own, which is so weird. Dogs don't do that, but cats can do that. Also, cats are not a good host for heartworms. Just like in some viruses things that can be transmitted from pigs to people or birds to people, things like that. All these viruses, all of these bacteria, all of these parasites prefer a specific host to continue their life cycle. So if they don't have that specific host that makes them more virulent, that allows them to continue their life cycle, they don't fare as well. So cats' immune systems are actually able to kill off the heartworms on their own. However, that also being said, there is no heartworm treatment for cats. No heartworm treatment for cats. They cannot have the heartworm treatment that we use for dogs. It is not used in cats. You can't. Cats are aliens again. They're so sensitive to everything. You can't do anything with cats. So the ideal thing to do with cats is to put them on heartworm prevention and keep them on heartworm prevention all year round, no matter what. Like Devin was saying earlier, with symptoms and things that you see from a pet who has heartworm disease or is developing heartworm disease, cats have the similar symptoms. So they can have a cough, they can have respiratory issues, exercise intolerance, they can have the vomiting, they can have, I'm trying to think of what else was on there. Anyway, it can cause significant damage in a cat's lungs if they get heartworm disease. There's actually something called HARD, and it's heartworm, God, what was it? Heartworm associated, that's right, heartworm associated respiratory disease for cats, because it will affect cats' lungs and it will affect their heart. You know, when you think about it, cats' hearts are teeny, teeny, tiny. So they can't carry a heavy worm burden anyway. It's typically a one worm burden in a cat. Unlike in a dog, they can have hundreds of heartworms in a dog. But in a cat, that one worm can cause significant inflammation and cause significant damage to that cat's lungs and to that cat's heart. It absolutely can. Is it typical for cats to lose weight near? Absolutely. Devin, you want to touch on that?
Is it typical? I would say yes. We do see a lot of older cats that lose weight as they get older. But my RVT recommendation would be to definitely get an exam from your vet, to have them check out, see if there's any teeth that could be bothering them, if there are any kidney issues going on, things like that causing them to lose weight. So run some blood work, physical exam. Those are all things we really recommend on those older kiddos. Hold on. Sorry,
and what you'll see in your cats, when people, even in dogs, you know, people think that their pet's losing weight, it's actually that they're losing a lot of muscle mass. So they'll lose a lot of protein, they'll lose a lot of that muscle mass. So it makes them look extremely thin, and you can see all the prominence of their bones, their spine, their hips, things like that. And that's because they're losing, it's muscle wasting. They're losing a lot of muscle mass. Disease processes can cause muscle wasting and losing that muscle mass in pets. So like Devin said, getting your pet into a veterinarian if you think anything is wrong, you know, is ideal. Definitely in an older pet, I would recommend doing every 6-month exams, and then doing, which we talked on last time, Devin, yearly blood work. Absolutely doing yearly blood work just to make sure, because things can change so rapidly in your pet's body that you just won't see. Animals are stoic. They're meant to be stoic, because if they're not, they are at risk for being killed. Okay, so they will be prey as opposed to a predator. So your pets will be so stoic, and they will still hold that. You know, I know people say it's, you know, wild animals, we domesticated them, but they still have some of those drives and they still have some of those characteristics. So they will be completely stoic, and you won't know. And they won't tell you because they can't seem weak, you know.
I was going to mention, like, the main thing we really see in older cats is we really see a lot of kidney disease, loss of kidney function. So I would definitely recommend a little checkup on your kiddo. But
yeah, for sure. For sure. I mean, I wish I was there. I would help you out, but I don't live in, he is in New York, Albany, New York. I do not live in New York, so I can't help you. But Devin and I are always here for any questions. Like, you can seriously message us anytime you want to talk to us about anything. But yeah, cats are sensitive beings. Like, if you are a cat owner and you are a cat fan and you love cats, you know cats are bizarre. They are just the weirdest, most alien creatures. They're just weird. Cats are weird. They are not like dogs. They are bizarre. They have weird diseases and weird things that their bodies do. Cats are just, in and of themselves, they're weird.
I'm gonna run and grab Sunshine.
Okay, so Sunshine is a cat that she took from the clinic that we absolutely love. I mean, she is an orange tabby. She is the cutest thing. So luckily we have clients that bring us, they'll find stray kitties or stray dogs and stuff like that, and sometimes they'll bring them into us. And if we have a technician, assistant, hospital staff that would like to take your, stray found baby, we will do what we can to try to find their homes too. But we will also take your baby home with us if we fall in love with it. Cats choose you, by the way. You don't choose your cat chooses you. I was going to mention one more thing that I think is really interesting. A lot of people don't think about this in heartworm disease, but it can be transmitted across the board. So it's not just dogs, it's not just cats. Ferrets are susceptible to heartworm disease. Some marine mammals are susceptible to heartworm disease. Seals, because they sit out, in the sun, on the rock, the ground. Oh,
You got
cats.
crusty eyes right now. I haven't cleaned her eyes.
Picked her eye boogers today.
Every day, gotta take care of my girl.
Her eye boogers. You gotta pick her eye boogers. I mean, it happens. Okay, it's okay. It's normal. Pets get eye boogers, guys. Don't freak out. It's okay. Sometimes it can be an underlying problem, but some pets just have weepy eye boogery eyes. Okay. Coyotes are susceptible to heartworm disease. Foxes are susceptible to heartworm disease. I mean, you don't think about this kind of stuff, but heartworm disease can be transmitted across all different kind of species of animals. It's not just dogs and cats. And just so you know, this is super weird. In rare instances, people can have heartworm disease too. Super gross. Now, I'm not an MD and I'm not a registered nurse for people, so I have no idea how that's treated in people. I can only give you advice for your pet, since that's what I do. But across the board, heartworm disease can be spread in all sorts of four-legged friends. So always speak to your veterinarian about your pet for appropriate medications, appropriate heartworm prevention, what they recommend for your specific animal, what you should use. Topicals, orals, that's the other thing. Which, Devin, topical preventions, oral preventions, there's so many out there.
Yes. I think we were going to talk a little bit about what deworming, right?
Yes.
Touching base on that.
Yes. So, yeah, your heartworm preventions are, inherently a dewormer because heartworms are worms, so they do deworm. Different medications deworm for different things, okay? So different parasites are susceptible to different types of deworming medication. It's not one and done. It's not all the same. There are tons of different ones.
Yes.
Go ahead, Devin.
Well, one of the main reasons deworming is important is, like you had mentioned, the zoonotic effect of it all. Like, it can be, some of the worms, different types of worms, can be transmitted to humans and to your little, if you have kids, your little family members running around in the yard where the dogs go potty, things like that. Even just, they don't wash their hands very well after touching their pet, and, your pet's infected. Worms are super common in puppies and kittens. We generally recommend deworming puppies and kittens. Just, we see that the most frequently.
Yeah.
But they can get them from the mother in utero. They can get them from just the soil, the environment, things like that. They can get it from other pets that you bring into your home. So you find a stray dog and you pick it up and you're holding on to it to find the owners. Things can be passed. So we deworm very frequently. We do annual fecals at our job to check for intestinal parasites. That heartworm prevention, there's different options as far as that goes. One of the ones that we love, HeartGuard, is also a once a month dewormer for hookworms and roundworms as well. So
shout out to VI and to our favorite rep, Jay. Veterinarian, what is he called? The field veterinarian. I don't know why that word always escapes me. Field veterinarian Erica. High five, high five. We love them. They are wonderful, fantastic people. We absolutely love them. Okay, cool.
There's just so many options, and then there's flea and tick preventions as well that we send home, just because those external parasites can transmit bloodborne pathogens to your pets. It's all just super, super important, and the main thing is to talk to your vet and see what the best option is for you. There's topical preventions and then oral preventions. There's not currently an oral prevention for cats, so topicals for cats, but it's just whatever works best for you, and I would definitely recommend talking to your pets and seeing which is best. Do you think of it?
Cats are bizarre again, and I don't know if y'all can hear the chirping, but that is Cookie. my son's parakeet, who apparently is very disturbed that I'm in here talking and ruining her day. Okay, I'm ruining her day by talking, and she's like, "Get out of here! You're loud." That is her. Yes, topicals, orals. The ectoparasites, which Devin was talking about, which are your fleas and your ticks. They can also transmit disease, so keeping them on a flea and tick prevention is also ideal. People don't think about their pets. Like, you think about you going hiking and you getting Rocky Mountain spotted fever. Your pet can get Rocky Mountain spotted fever too. Your pet can get Lyme disease, just like you can. Your pet can get ehrlichiosis, just like you can. You can get these same bloodborne pathogens that your pet can get too from the same ticks that bite you as you're on hike. So do keep that in mind. If you don't want ticks and fleas crawling around on you because it's gross, fleas also transmit terrible diseases. Fleas are buggers. They transmit terrible diseases, especially in cats. Again, cats are weird. Fleas will transmit nasty diseases in cats. Anyway, so keeping them on preventions is always ideal. But again, like Devin said, talk to your veterinarian about what prevention is best for your pet, for your livelihood, where you live, what you do, if you go hiking, if you don't go hiking, if your pet's inside all the time, if your pet's not inside all the time. All these things play a factor as to what preventions your veterinarian or your veterinary professionals, your nurses, your veterinary support staff, all of us will help you in picking out the appropriate preventions for your pets. We are here as a resource. I put that on one of my posts. Your veterinary technicians, your veterinary assistants, your veterinary support staff, they are very educated people, and they are here for any questions you may have. And we always get people that say, "Oh, I have a silly question." There are no silly questions. That's what we're here for. You guys are not supposed to know all this stuff. You didn't go to school to learn all this stuff. We did. That's what we're here for. We're here to support you. Any questions you have, any concerns you have, that's what we're here for. No matter how big, how silly, that's what we're here for. We're here to help you and, let you continue to have that healthy, happy bond with your fur baby. We want you to have that healthy, happy bond with your fur baby because we have that with ours. So we're here for anything you need. So no question is taboo or weird or dumb or silly or anything. You can ask us anything. Most veterinary professionals are, we're kind of crazy. So
I think I wanted to touch on, we had also talked about it, I think yesterday with Erica, about how important the veterinary field is as far as human medicine as well.
Yeah.
We, by preventing these diseases that can be passed on to humans are super, super, integral part of healthcare. Another thing as far as intestinal parasites and all these things is that there are a lot of people that are considered high risk, like children. I had kind of touched on that already, but like pregnant women,
Yes.
cancer patients,
Yep.
anyone with a suppressed immune system. And it's super important to, you know, have those conversations and make sure that you are taking care of and treating and preventing these things in your pet so that it's not coming and getting passed to you.
You could use a tapeworm for a month. Just so you know, tapeworms are not in pets are not like you think they are, like they are in people. Okay, so just so we're aware, tapeworms are spread by fleas. Super freaking gross. Don't need a flea, and you'll be okay.
They look like little grains of rice.
Yes, they're little egg packets.
Ugh.
It's really gross. They're little egg packets. That's what we have to look for. It's really disgusting. I will have your apartment filled with 5 cats and 2 dogs, probably because, you know, you need someone to love you. Okay, you need all the cats to love you, and you need all the dogs to love you. But
I have 4 cats and 2 dogs, and it's not enough.
Devin loves all the cats. Like, if she could have a cat city full of cats where she would just sit in the middle of the room and snuggle cats all day, she would be on cloud 9. Like, I love cats too. Don't get me wrong. I love cats. Cats are my absolute fave. Don't tell the dogs. I like dogs too, but I am a cat person. I don't know if I could live in a house full of cats, but Devin could.
Oh, I could.
Devin could. She could live in a house full of cats, that's for sure. Well, you know, at the end of our Facebook Lives, again, if you guys have any questions, please, please, please comment, message us. Even if you're watching this and you don't think of anything and you think of it later, drop me a line, drop me a comment on my Wax, Whiskers, and Beyond Facebook page. I will do my best to answer any question. Any topics that you guys have that you want Devin and I to touch on, we are open to it. Just drop us a line. We'll talk to you. But, you know, at the end of everything, I have to show you guys the really fun things that I carry at my boutique. Okay. These are so cute. I got these for Valentine's Day. Okay, because you know Valentine's Day coming, and your pet has to be festive. You're festive for Valentine's Day. Why wouldn't you make your pet festive? So these are so cute. Okay, look at these. How cute are those? So they're little scrunchies. They go. This is a small one. This is not a big one. Okay, so keep in mind, I'm not going to strangle your dog. Okay, this is a small one. They go around your pet's neck. They go around your pet's neck like a little collar. And look at the little hearts. They're glitter. I don't know if you can see that or not, but they're little glitter hearts. Who doesn't want their pet to have glitter hearts for Valentine's Day? How cute is that? You're going to go ask your girl to marry you, and she loves her cat or she loves her dog? Right here. Put this on her. Have the dog or the cat deliver the ring. There you go. Look at how cute those are. Oh, my God. I would wear one. Okay? I'll put one on Sunshine. I'll wear one. Sunshine and I will wear one. Okay. Speaking of cats, I got these super cute cat collars. These are velvet with all the little blingy bling, because, you know, if you got a cat, they got to be bougie. Okay, they got to be blingy bling. The cool thing about these is these are breakaway collars. I love breakaway collars and cats. These cats are, you know, so curious and known to get into things. So even though you have your little buckle here that you can, you know, hook it on, they are still breakaway collars. So if your cat gets stuck somewhere, it'll pop and your cat can get out. So he's not going to strangle himself. Okay, but look at that. They're velvet. Those are velvet. How cute are those? I have all sorts of colors. They're so cute. It gets better. Hold on. Now, Mark, my husband, fell in love with these. He thought they were so cute. How cute are those? Those are sailor collars for dogs. They're sailor collars. How cute is that?
Oh, I think I need that.
Yes. You know, they're, of course, because they're brand new, so they're not, you can, you know, move them around and stuff and get them where they're a little looser, but right now they're brand new. So look how cute that is.
That's so cute.
And they have the little hook where you can put all your stuff on. I got it. That's a small one. That's a teeny one. But here's a bigger one in white. How stinking cute is that? Is that not the cutest thing? Oh my God. They're so cute. They look like little collars, you know, for your dog. Super cute. I had to show you guys that. And one more thing, because this is super cool. And don't forget, I remember you pet parents. Okay, I remember you. So this is a water bottle. Okay, this is a water bottle for those of you that go hiking and what have you. Okay, this is your water bottle. This is your water bottle. Not only is it your water bottle, you can pop this bottom piece off, and it's your dog bowl. So you can pour your water from your bottle into a water dispenser for your dog. So you're not carrying a water bowl and a water bottle. You're just carrying the water bottle with the bowl attached to it for your dog while you're hiking. Super cute. Okay, it just comes right off the bottom, just like that. I think these are so cool. I really like them. Yeah, so I had to show you guys, not only do I have stuff for your pets, but I have pet parent things too. I think I told you that last time. Okay, so I have these too. Anyway, we have to end it with the cool things, okay? We have to end it with it. So, well, thank you guys for hanging with Devin and I this afternoon. Sorry we had to change the time. Truth be told, Devin and I are taking our kids skating, and skating is from 2 to 5. So we had to have that 2 to 5 window so that we can take our kids roller skating, because we're cool moms like that, okay? We're cool moms like that. We go roller skating with our kids. So we had to move the time up.
It's going to be chaos.
But I love you guys. I love you guys for joining us. I love Devin. I love all my friends who joined, my family who joins. Thank you guys for being a part of our Facebook Live. We're here for you. We're not here for us. We're here for you. Anything you want to talk about? We're here for the fun. We're here for the tea. We're here for all of it. All of it. Okay?
Yeah.
Whatever you need. So without further ado, I guess we'll say goodbye to you. We'll be here next Sunday. We're going to do this every Sunday. I'm going to add something fun for the second Sunday in February. So make sure you guys go ahead and follow. I'm not going to tell you now because I'm not going to spoil the surprise, but we're going to add something fun next for the second Sunday of every month. Okay, words are hard. Okay, second Sunday of every month. You guys got to follow us. Like my page, follow our Facebook Live every Sunday. I have an Instagram. You can see all my fun products. I'm going to have my friend Devin with me all the time, my fantastic friend Devin. So you want to tune in and listen to her because she's pretty great. Okay, she's pretty great.
All right. They're just here for the cats.
That's fine. Be here for the cat. Be here for sunshine. Be here for sunshine. She's the fattest, most snuggliest cat ever, by the way. All right, guys. Okay. Well, thank you. Thank you for tuning in. We love you.
Thank you so much.
See you next week. Bye.
Bye.